everyone. We are just getting ready to get started, and we just need a couple more minutes. But what we're going to do today is we're actually going to do a reverse of things. We're actually going to start with our sponsored portion first, and then we're going to get into the educational portion. So we are excited to welcome MediUSA as our sponsor today.
Couple more minutes.
And let me get rid of this echo. What we're going to do is we're going to introduce Jonathan, who is a clinical educator for MediUSA. So Jonathan, come on to the stage, please. All right, there you go.
Hi.
There's Jonathan Wing. And the interesting thing is that his last name is Wing, which is my maiden name, which is basically the Smith of Vietnamese last name.
It is.
So Jonathan is a medical educator from MediUSA, and we're just going to give him the floor for a few minutes as I pull up the Medi video.
All right. Hi, everybody. Thanks for joining us on this Sunday afternoon. And again, I know my title on my screen probably says Christopher Miles. That's my boss over at MediUSA. I'm using the company login, but also may wonder about my sunglasses. I'm dealing with a case of iritis, so the bright lights being on the screen affects me a little bit visually, so hence the sunglasses indoors. However, I'm really glad to be part of this webinar series with you guys today, and I was asked to answer any questions that might come up. We haven't got there, so in the meantime, if anyone is familiar with Medi and Circade, we are based in North Carolina here in the US, and in Bayreuth, Germany as our global headquarters. We have a whole host of products, from everything covering your wound care, venous insufficiency patients, through lipedema, lymphedema as well, and in a whole range of ready-to-wear, custom, flat knit, inelastic products. And Circade, of course, is that family of inelastic Velcro based products. And we're really proud of the Circade series. We have our ready to wear Juxtafit Essentials and Premium. And then we have our upper leg with knee, which is a product that I find a lot of therapists are just discovering, but it's been out for a little while. It's a combination of a thigh and knee unit all in one piece, which is ready to wear sizing and also trimmable. So that's a really nice feature of that product, is that it can be still somewhat customized for your patient's needs. And it minimizes the amount of pieces that they have to keep track of and don and doff every day. So if they just have a lower leg Juxtafit with the upper with knee, that's only 2 units. And it's a really simple system for them to use and to really master. We have a whole variety of foot pieces. Some are customizable, some are custom made, and then some are ready to wear. And for the upper extremity, the Juxtafit Essentials arm sleeve is a really nice inelastic solution for those patients with upper extremity lymphedema. And it has a built-in liner, which helps it be easier to don. So especially dealing with one upper extremity, trying to bandage or trying to get on any type of a more elastic type garments may be difficult for them. Having the lower resting pressure of the inelastic, putting it on and then tightening with the Velcro really makes a huge impact on their quality of life by giving them more time in their morning as they're donning their garments, so they can get out and enjoy the rest of their day.
Jonathan, so thank you so much for that little intro into Medi.
Sure.
We really appreciate that, but we
course.
actually got a chance to rename you, so you are you now.
Oh, yes.
Yeah. And then also, we're all ready for the Medi video, so we're gonna play it now.
All right.
All right, so everybody just sit tight, and here we go.
Welcome, everyone. My name is Christopher Miles. This is Brian Grollo. We're both from the clinical education team at MediUSA, and we're super excited to bring you this session today. We're going to continue to focus on compression. And maybe, Brian, you can give us a quick recap of why is compression so vital in managing lymphedema at home?
Absolutely. Christopher, compression is really what it takes to contain and reduce edema. If we want to keep our edema under control, we've got to wear compression.
So we're looking at a typical compression garment, which would go up to the knee. When would someone have to wear something like this?
anyone with any type of residual swelling, somebody that might have vein disease would have to wear something like this, and lymphedema.
Okay, very good. And as a quick review, how is this garment made, or how does it apply compression to the leg?
Well, let me kind of go into how compression actually works. Okay. Basically, what happens is there's a certain amount of pressure that's put within the garment. And in this one in particular, we have 100% of the pressure is right here in the ankle. And then gradually that pressure reduces as it goes up the leg. And so what's happening is it's promoting fluid to go from the bottom up to the top to the body where it needs to go to begin with.
Okay, now my question, I'm going to ask you a two-part question. Does all compression work like that with moving it up? And is this the same compression that folks have to wear in the hospital, like those white compression hose?
Well, let me start off with the way all compression is made. Not all compression is equal. Not all compression is made the same. What we want is for people to wear what we call graduated compression, which is everything I just explained about making sure the pressure is at the most at the ankle and slowly reduces on its way up. Now, the ones you're talking about, the white, what we call TED hose, those were used in a hospital setting for people that are basically in bed and can't move. And those aren't really a therapeutic amount of compression to manage edema. They're to prevent a blood clot. That is it. And that's all they're good for. So no, that is not something I would use to manage edema. This is a very different level for sure.
Okay, very good. And if someone was buying compression or looking for compression, how might they know what to choose?
Well, first of all, anytime you can meet with your specialist, if you're a lymphedema patient, you've got a lymphedema specialist, that person can really help guide you in what you need, because there's different materials, different thicknesses of material, and different compression levels. So we really look to our specialists to guide us on what we're going to need.
Okay, great. So getting connected with a lymphedema therapist to understand where you are in the progression of your lymphedema is certainly very important. So that was just sort of a quick review on general compression. I think that was fantastic. But what we want to focus on today is an alternative to this. And what we're going to do is we're actually going to talk about a Circade product, which is more of a wrap style compression. So Brian, what is a Circade?
A Circade is a circulation aid, actually.
Okay.
And it's an alternative to elastic compression, like you see here. Sometimes these are not easy to get on, and so what we have here is an alternative to that. We know we have to have a certain amount of compression depending on how advanced the disease is. And this just makes it easy to put on, easy to readjust. As you can see here, it's got Velcro straps, and you can get the compression amount that you need applied very easily just by swiping it up.
Why do you think that it's easier to get on?
Because this product does not have elastic in it, for one, and because of these straps, you can actually undo all these straps. I'm not going to do all of them now, but you can see here, you can just strap it right on up, and that makes it really easy just to put on.
Okay.
As opposed to pulling on that side.
So what we talked about before is we talked about the elasticity in this knee-high garment that is on here, but you just confused me and you said that this doesn't have any elasticity in it. So how does it give us the squeeze that we need?
By the pressure of the straps. Actually, we've got this card here which helps us to know how much pressure we're putting on each strap, and we can tighten these straps up just according to how much pressure we need. And literally just by tightening these straps, we're putting the pressure on that we need to the leg. And it's still going to have that graduated compression I just mentioned all the way up the limb, making sure we're moving that fluid from the bottom to the top.
And I see that there's two different colors here. Why is that like that?
Right. Well, that's a good question. There's actually compression in the foot of this sock. And the underliner, as you can see here, there's really, that liner goes throughout the whole garment, and there's no compression in the liner portion of it. The compression comes from the actual circuit itself, but there is compression here. Again, so we have that gradient compression. We've got to make sure we're not going to push any swelling into the foot. So we compress this, so it's just one continuous amount of compression from the foot all the way up.
So this comes as one piece, and you're saying that this comes as two pieces?
Correct. Yes.
And do you always have to wear both pieces?
Yes, definitely. You always want to make sure you've got compression in the foot. You don't want to wear this without that.
So, okay, so we have two alternatives here. So how would someone know whether they should go with this or whether they should go with this?
Well, that's a good question. Two-part answer to that. One, first of all, can be determined by how much difficulty one has applying compression. If they're going to have a hard time, sometimes you see this in a more geriatric population, people with maybe arthritis might have to use something like this to get the amount of compression on that they need. But the other thing about the Circade is that it's not just a product that you can use for daytime, you can also use it at nighttime. So it has multi-function to it. This is really a daytime only product. And some people need compression at nighttime, and they could actually potentially wear this for the nighttime and the daytime, which makes it a really good alternative in that respect.
So why might they need it day and night?
Depending on how advanced someone's disease process might be, people can swell up during the night, and they need containment during the night too. And
so can they not wear these at night?
No, you can't wear elastic. This is an elastic compression garment. This is inelastic. And when you've got something with a lot of elasticity, there's a lot of pressure when you're not doing anything. We call it resting pressure. And you don't want that when you're sleeping. We don't want this to wrinkle up on your limb when you're in the middle of the night sleeping. You want to be always aware and cognizant of it. Whereas this won't do that because of the fabric and material that it's made from.
Very good. Now, when I'm looking at these, appearance-wise, I would probably go for this one.
Yeah, me too. I like that.
What would be the main reason why I would have to go with this option more than this one that is smoother and thinner?
Again, it has to do with what are you doing to control and manage your edema independently at home. What it comes down to is we've got to make sure the edema stays under control. And if this doesn't quite cut it, this isn't enough compression, well, then we might need to move into this because it's got thicker, stronger fabric and it contains edema better. And that's really what it comes down to. What's going to contain your lymphedema the best?
Okay. So in thinking about that, would there ever be a time when I may want both?
Absolutely. Absolutely. I tell a lot of my patients, if this is what you like, the low profile look of this, you're going to social functions, this looks like a normal sock. This is what, like I just said, and you said, this is what I would want. Totally. But at the same time, I know that if it's not going to manage or contain my edema all the way throughout the day, I want to make sure I go into this because I know this is going to take it back down to where I need to be. So people use them together all the time. In fact, this can really make this product very successful. It can really make the home management or home maintenance program very successful.
Okay. Now, in regards to for the Circade product, you said that there's more adjustability to this. Can you explain that more?
Mm-hmm. So the more you tighten this, the stronger it's going to get in each one. And a lot of times to manage edema, you're looking at, they usually are going to get you 20 to 30 or 30 to 40 millimeters of mercury compression is what we refer to it as. And this has just different levels of that. You can set it to 20 to 30 or 30 to 40 or even 40 to 50. Just different levels of compression, again, depending on how much edema there is and how much you need. It's adjustable in that sense. And throughout the day, if the limb, let's just say the limb maybe goes down in size because it was swollen, you can just readjust these straps and kind of refit it to your limb again. And it just gives you a nice new snug fit. Like we said, give your leg a hug. And you can just continually do that with adjustable straps like this.
Okay, so that sounds like it has more flexibility in sizing. Like, let's say I took a day off and wearing my compression and my leg started to swell. If this didn't fit on, would this be an option to be able to help get me back where I need to be?
Yeah, this is going to fit for a wide range of size. This has a size range. This has a size range too, but this can accommodate for, I would say, what I call a rainy day. If you have a bad day and you couldn't get compression on and you do have a flare-up, this is going to be able to get you back down to be able to keep fitting into something like this. But there's a lot of flexibility in this, for sure.
Well, good. And in regards to sizing, in regards to, we're talking about the Circade product, where can I buy one? Who can size it for me? How can we point some of these folks in the right direction to maybe try a new alternative?
There's a lot of different places to get products like this. There's a lot of online medical compression stores that you can look up. There are also a lot of people have them in their local durable medical equipment supplies. So not hard to find either online or in your local medical equipment stores. Lots of sizes in this. We've got 16 different sizes in it, so we can accommodate for, you're seeing it on a relatively small limb here, but it can accommodate for a much bigger size than this. So you should be able to get pretty well taken care of.
All right, well, fantastic. So a garment alternative, so everyone's familiar with a regular elastic garment, comes in different materials, in different dosages of squeeze, if you will, to maintain your swelling. Certainly introduce the Circade product as an alternative, as Brian talked about. It can accommodate different sizes if you get in trouble or you start to reduce. It comes in different sizes and shapes, and you can adjust the different compression level. I think what's most important is that you team up with your lymphedema specialist to find out what's right for your condition. So that you can find, again, we're just focusing on knee-high products here. Knowing the Circade product, I'm assuming that it does more than just knee-high products?
Absolutely. We make them for the full leg. We also make them for the upper extremity as well.
Okay. Yeah. So fantastic. So again, compression, very vital in managing lymphedema. Know that there's an alternative out there if you're looking for maybe a boost of what you're currently getting, or you're looking for an alternative to maybe make it a little easier. The Circade may be a product that could work out for you. So please check in with your local lymphedema specialist, and I'm sure they'll be able to give you more information. Thank you very much. Have a great day.
That was awesome. Thanks so much, Christopher and Brian. And if we have any questions, which I think we do, we're going to welcome Jonathan back onto the scene. And Jonathan, I'm just going to hide my video because,
Sure.
You're the star right now, and I'll ask you the questions. Okay.
Absolutely.
The first is, what suggestion do you have if someone is using a custom Juxtalite two-piece for the leg, where the thigh piece won't stay up and in place?
Right. This is a surprisingly common question. So common, in fact, I was in a lymphedema therapist Facebook group last night, a little after midnight, answering this very same question for somebody else. But it's very common, unfortunately, to see the thigh piece sliding. That's what a lot of people who try it mention. Whenever a Circade product is on, because the tension comes from those Velcro straps, if the patient reduces, there is no higher resting pressure like there is in elastic fabrics, like a circular knit type of garment, that's going to hold it in place. So those Velcro straps really do need to be adjusted very frequently throughout the day. If you notice it sliding, it's probably because the limb is reducing in volume. And so you need to really make sure that those straps stay adequately tight enough to stay on the leg and help manage that edema, control that edema throughout the day. The other thing is donning positions. So it's going to be a lot easier to don or to put on the thigh piece in standing whenever possible. That allows the material to be positioned closer to the hip joint, to the inguinal crease. And you really need that really high up positioning on the thigh to help keep it from sliding, because it really needs a good anchor point. And the closer you can get to the hip, the better. If the patient is trying to put it on laying down, or sometimes even sitting in a chair or on the edge of the bed, sometimes you can't quite get it high enough on the hip to get a good secure placement. And then when you stand up, then it changes in position and it starts to slip. So really making sure you put it on first in standing whenever possible. Make sure it's good and tight, snug like a really firm hug on your leg. And then also adjusting those straps throughout the day is going to help keep it in place.
Thank you so much. Another question from Ned is, would there be a difference in pressure and resistance to swelling between the Velcro Circade and the elastic foot piece?
Well, there are certainly differences in the material structure. So yeah, there's going to be a little bit of change in containment factor. Hopefully by wearing that sock, it's something that the patient can fit more easily into some type of footwear like a lace-up shoe will provide some good inelastic compression value there. If their dorsum is very swollen and they need some additional support, we do also have inelastic Circade foot pieces, so things like the pack band or power added compression band. We can also use things like the customizable interlocking ankle foot wrap if they need a little bit more heavy duty support around the foot and ankle. And those do add a little bit of bulk on the foot, but if you're looking for that stronger containment and better reduction capacity, then those are going to be your better additional options. I would put that over top of the liner because the foot piece is connected to the liner for the rest of the leg. So you are both in tandem, and that will help give you the support that you need.
Thank you. Another question is, can the Circade and an elastic garment be worn concurrently? Are there any benefits to doing that?
I would not advise that in that situation, because what happens with compression when you start stacking or layering compression is that the values add together, they don't average out. And so if you put on, say, a 30-40 knee high, and then you put on a Circade and you tighten it to 30-40 millimeters mercury using our BPS or built-in pressure system card that Brian was demonstrating in the video, now you're talking about 60 to 80 millimeters mercury, because those two 30-40s are combining together. And with some patients in particular, you have to be careful of if they have a lower ABI, maybe they have diabetes or some type of peripheral arterial disease. Applying too much compression is going to be more harmful than helpful. The other thing you have to consider is things like wearing overnight. The Circade on its own is safe to wear overnight because it's inelastic. It has a lower resting pressure, higher working pressure. The elastic garment underneath has a high resting pressure built into it. So now we have a high resting pressure overnight, which again in the video they mentioned is not going to be necessarily the most safe situation for your patients.
Thank you. Another question is that Anne has, she said circadian, but I'm going to go with that. She has a Circade. So Anne has a Circade, but she also had to get the piece for the foot. Is there a piece to add to the bottom to prevent slipping?
To the bottom of the foot piece?
I would think so, because she said that she also had to get the piece for the foot, and I guess that's the foot piece of the Circade. So she's asking if there is something that she can add to the bottom to prevent slipping.
You could, so from Circade, there is nothing to add to the bottom of the foot piece to prevent slipping. But what I have seen a lot of therapists do is use something like a hospital sock over top of that, if it's something that they want to wear around the house, but without having shoes on. Obviously that felt fabric is going to be a little bit more slick on some surfaces, but a hospital sock has that grippy texture to it. That can definitely help in terms of safety. Or if they have some type of house slipper that would be safer to wear around the house, that would be advisable.
Thank you. Do you have any lower extremity garments that offer greater than 50 millimeters of mercury of compression without it being custom made?
Absolutely. So we have, even in our ready to wear, so we have like circular knit, we do have circular knit garments, things like our Forte, which is our strongest circular knit that we make, that's going to be the step just below a flat knit garment, starts out at 30 to 40. And then it also has a 40 to 50 option, and that's off the shelf in circular knit. So for patients who are kind of entry stage of lymphedema, lower extremity, they need something that is not necessarily custom. They have a good anatomical shape. There's no shelf at the ankle or anything like that that's going to require a custom type garment. If they can fit into an off-the-shelf sizing chart, the Forte is a fantastic product, and it does contain much higher, 15 to 20. I think in the lower extremity, those would be more like our venous support products from Mediven. I don't think in Circade, we can have variable compression. In Circade, we have variable compression because it is Velcro, so you can adjust how tight you pull. So you can have that 10 to 20, 20 to 30, 30 to 40, or plus, based on the BPS card that Brian demonstrated. And those lines are, I'm telling you, they're like this far apart on the card. It's very easy to move from one grade scale to the next. It doesn't require a lot of force or tension or strength to adjust. Pretty much if you can pull the suction off a refrigerator door to open it, you can pull to about 40 to 50 on those circuits. So if you're looking for something with more than 15 to 20, there's a whole lot of options between our circuit and our off-the-shelf series. And then if you do go into custom, odds are you're going to need more than 15 to 20 anyways, because we're talking about heavier tissue, more difficult shapes and shelves and lobes and things like that. So most likely custom garment is not going to be 15 to 20 for lower extremity.
Thank you, Jonathan.
Mm-hmm.
Sean asked, MediUSA used to carry a sticky adhesive cotton wrap that would be worn directly on the skin under the thigh circuit piece to keep it from falling. Do you know why this was discontinued? And is there something comparable that can be used to achieve the same results?
Yeah, that was discontinued not last year, but I think at the end of the year before. So I think the end of 2019 or something like that, or thereabouts. I think it was, without knowing all the specifics, it had something to do with production of the materials that went into it, basically. So it wasn't from our end, it was from a supply chain issue, but there isn't anything currently available, but I think they are working on bringing that back. So stay tuned.
Thank you. And then let's see, because there are a couple of questions that came into the chat. So let me just look at them. Do you need, this is from Alice, do you need a prescription for garments? How do you figure out the correct level of pressure? Can you use the upper only if there's no swelling in the lower leg?
Okay, there's a lot to answering that question. So do you need a prescription for garments in general? Depending on what you're looking for, no. So you can get like a 20 to 30 millimeter mercury stocking without a prescription. Typically 30 to 40 millimeters mercury is what's called medical grade or considered medical grade. And that does require a prescription in most cases, just because it is a bit higher in millimeters mercury pressure. That would come from your primary care, or if you're seeing a cardiologist or a vascular specialist, something like that. Let's see, the next part of that question, could you use the upper only? I would not recommend using upper compression only and not anything distally, kind of like what Brian was alluding to with the foot piece. Anytime you apply pressure proximally or closer to the trunk and not have pressure distally or further away from that section, it creates kind of like a tourniquet effect. And so it basically prohibits that lymphatic fluid and the rest of your circulation from returning back to the heart. So you need that consistent gradient of compression to help move that fluid proximally. There was one other part of that question. I know one was prescription and one was upper. What was that third part there, Jeanette?
The third one was, how do you figure out the correct level of pressure?
The correct level, yeah. So that's going to come down a lot to the specific diagnosis and any potential comorbidities or other diseases that are going along with the reason for needing compression. That would be best decided in most cases by your clinician. So whoever's seeing you for your edema, whether it's your lymphedema therapist or a venous specialist, they can make those accurate recommendations more so than, just me on a webinar making a guess. So
thank you. The next question is from Leora, and this is a question I've always had myself. She asked, will you be coming out with a slant top for the thigh piece to capture the tissue on the lateral thigh?
A slant piece for the thigh. Yeah. So actually our Circade upper with knee, which was not shown in that video, but it does have a lateral rise. It is left and right specific, and it is anatomically designed to have that curvature where it comes down a little bit so it can fit close into the groin, and then laterally it's going to have that rise over the hip. So it can only extend so far because otherwise you're not getting good compression really, because you have to have that circumferential compression there to really support that tissue. So if you go too far up and have nothing to compress against it, you're starting to lose compression value actually. So with our design having that lateral hip rise, it is a very nice fit and contour to still be effective. if you haven't seen that, I highly recommend getting a look at a sample from your local rep or DME.
Thank you, Jonathan. And the last question from Alice was, she clarified her question. Do you need a prescription for the Circade product?
So you can. It's again going to be dosage dependent. So if they want you to wear it at 30 to 40 for lymphedema or for some specific reason, because it's variable compression, it helps to have a prescription if you're trying to go through insurance. If you're just paying out of pocket cash, then I believe you can just get that from your local DME.
Awesome. Jonathan, I think those are all the, oh, no, wait, one second. We have
Wait, there's more.
Yeah, we have a couple more minutes. We can do this. Let's see.
Yeah.
I think this is important because a lot of these questions are really just like, the nature of compression garments. So Mary asked, when she wears a circular knit, it tends to grip around the ankle and cause inflammations. Is there something that she can do around the ankle for an off-the-shelf garment to prevent this?
Yeah, so with off-the-shelf circular knit, again, it's woven in a circular loom fashion. So it's basically like layers of rubber band just stacking on top. And so the nature of that resting pressure in that material is always going to be to try to find the smallest circumference and stay there. So things like binding at the ankle or behind the knee and the thigh high, very common complaints. So dosage is a very important part of the equation. So things like 20 to 30 or 30 to 40 millimeters mercury when we talk about that. But wall stability is also very important. So if you're having that issue, if the material is very sheer or transparent type of fabric, you may need a thicker material. So something like the Forte, which I actually do have a sample of right here. So this, you'll notice this is our Forte fabric, and it is not very transparent or sheer at all. It's quite opaque. And so this is going to be coming in at like a 30 to 40, like I mentioned, or 40 to 50 option, open toe, and with the silicone top band here. And this will have less of that biting in as some of those more sheer fabrics. And then remember that Circade can also be off the shelf. So if it's an issue that you're struggling with your circular knit type garments, then with Circade, you can adjust the Velcro, and there is, it stops at the ankle, and then you have that liner with the foot piece attached. That will cover the rest of that territory. And you will have less bunching of the material there because it's not going to have the same type of material structure. That wall stability is going to be different.
Thank you. And Mary, I'll be adding a couple of extra tips too in my demonstration. Ned had asked, what is the maximum pressure that anybody can get for the lower extremity? For example, he's asking, can he get 110 millimeters of mercury of compression for below the knee?
110 is a lot. Can you get there? Yes, in one single garment. I would challenge anyone that needs that much compression to try to get it on in a knit type garment. It's going to be very challenging to stretch the material to get a foot in there and up the leg. You can achieve it through layering. So like I said before, compression stacks, it doesn't average out. So if you had 40 to 50 garments, millimeters mercury garments, that would be 80 to 100. Technically in flat knit, class 4 is 49 to 60. So that's 50 to 60. So that would be closer to that 100 to 120 range if you had 2 class 4 garments on. But, is that going to be I would ask what's the reasoning for that much compression, because that's very atypical compared to what we see. Even in very severe primary cases, that number does not typically go that high. And if it's a material issue, if they're swelling through circular knit, you move to flat knit. If they're swelling through flat knit, you can move up to inelastic, which is our Circade family. And that will help provide hopefully better wall stability. So again, it's not always just about dosage, about the millimeters mercury. It's also about wall stability of the fabric.
Thank you, Jonathan. Charlotte had asked if there are any, different tools and accessories to help put on the garments a little bit easier. And that is the point of today's talk. So I'm going to show that momentarily, Charlotte. Marsha asked, are custom Medi stocking thigh highs medical grade, usually flat knit? And if the above knee part of the stocking slips, can you use a sticky substance to keep it up? And what's the best way to keep it up?
Yes, so all of our flat knit garments and circular knit, but especially since the question was about custom, are medical grade. So they are full graduated compression, medical grade, and the donning techniques. So if it's slipping at the thigh, one, I would make sure that if you've reduced, that could be one reason why it's slipping, or if it needs to be tighter in any of the measurements in order to give you a better fit. So those are the two things I would check. You can use a sticky adhesive. We do have one from Medi. It's called It Stays, and it's designed by Medi to go with Medi garments. And you can get that at your local DME or provider of choice as well. And then donning, if donning is an issue, I know Jenna's going to do a little video on this, but some people do need like 30 to 40 or 40 to 50 compression, but donning it in a flat knit or even in a circular knit especially is very challenging. And that's one beauty of the Circade family, is because you're not struggling to pull the garment up onto your limb, the Velcro goes on very easily, and you can achieve those pressures with much less effort. And so it's a lot less hassle to put it on. But I know Jeanette has some additional tips and tricks she's going to show us.
Well, yeah, Jonathan, I'm going to ask you to stay on for a little bit because,
Sure.
Something that everybody can consider, because keeping the garments up is always such a challenge, because again, what I've been saying throughout many webinars is that when you have an hourglass presentation, which is the inherent shape of like the knee area, the elbow area, you'll kind of get like, the contours coming out and then in and then out again. And garments will always want to gather in the most narrow part, unless you are a perfect column. And if there is like a hill and valley formation in the arm, which is natural, and also which is natural for the leg as well, because you have the ankle joint and you have the knee joint, then it's going to be something that you're always going to be fighting gravity. The garments are always going to want to slide down into those narrowed areas. So all of the sponsors, all the garment manufacturers, they have like different types of silicone borders. Now, you want to first of all make sure that you don't have an allergy to the silicone, which is a very, very like uncommon thing. I think that it's very rare that people have a silicone allergy. And if you think that you have a silicone allergy, I think what is more common is that when you wear the garments and they have the silicone, that, it's an area where like the moisture can just kind of like stay, and it'll kind of like make you perspire a little bit more. And then that like extra perspiration kind of like is what causes the irritation more than the silicone itself. So the thing with that is, the key to that is to make sure that the moisture level of your skin is like well balanced and it's maintained, and that if you are a little bit more sweaty, and it'll usually happen in the summer when you perspire a little bit more, less frequently so in the winter. And so in the summertime, you just maybe might need to like give it a little bit of a wipe down once or twice throughout the day, so that the moisture buildup isn't as intense. But there are different types of silicone, and because I don't know the names of these particular Medi ones, I just want you to stay on, Jonathan, so you can see what they are. But there is this kind.
So that is our profile top band, and that was actually discontinued last year for actually a lot of the reasons you're discussing. So now we have the only option that we have is the beaded silicone. We have variations of this beaded silicone. There is one top band that's a flat silicone. It's very less common. We have that as our micro bead silicone for sensitive skin.
Yeah.
And so that's really nice for patients who do have some skin sensitivities. Maybe they have post-radiation skin burn or scar tissue that's healing. And that is going to be much softer and more gentle on that tissue.
And what I like about this one is that, so whenever you come to the point of the silicone, more often than not, the material is a lot tougher. And because the idea is to keep the garment up, but that sometimes comes at a little bit of a cost, in the sense that it cinches in. And especially if you're not toned, like I am not totally toned, you will totally see it. Like it will grab you at that point, and then all of a sudden it'll come out. And so when depending on the silicone border that you're measured for, and this goes for all manufacturers, if it is the type that grips it in a little bit more, then you'll have to be a little bit more thoughtful in terms of the measurements that are entered. So for me, when I measure patients, and if I'm getting your standard silicone where, well, first of all, it's very rare that I get your standard silicone all the way around. For me, I always like to make sure that there's a break in the silicone so that it doesn't grip it. So if I were to order something like this and it's a custom garment, I order a 3/4 silicone, so that basically for a quarter of the circumference, it's the same material as the rest of the garment, and it gives a little bit, and you won't have to worry about that cinching in. So that's the first thing. But if you are going to continue with a full silicone border that does grip in, then what I sometimes do is I add measurements, like I add to the measurement. So if this, like, let's say if I measured this for my knee, for just below my knee, and like, let's just say it was 30 centimeters, then I would make it like 33 centimeters or 32 centimeters. And so it all depends. Like each manufacturer has a little bit of a different nuance that you just have to look, like that your therapist would have had to like learn if they're going to do that. Otherwise, a safer thing would be to go with, like, if you're just going to measure as is and you're not going to mess around with the measurement, like a silicone border like this, which is totally flat. I don't know, I just call this a flat silicone.
Yep.
Yeah. And basically it allows, you know, a give. So it's basically, it does not cinch in like the rest of the, like it would with your standard silicone.
And that's the one that I was mentioning. We do have that's flat. It's our rose silicone top band, and you notice it has that kind of lacy imprint on the outside of it there.
Yeah.
And that is, that's our rose silicone top band.
Yeah. And so that's something to consider when we're talking about the silicone. So thank you for letting me digress and going into that a little bit. I thought that was important.
So I just, if I can on that, just to discuss, like you talked about the hourglass shape and how the material tends to dig in. Again, a lot of that has to do with that resting pressure and the wall stability of the materials. So I had an example here of, this is our 550 material, which is our most robust containment fabric. And this is in a bike short. So I guess this is my demonstration piece that shows the gluteal shaper. So this is another, another option. But the 550 material is very well designed and will not dig in as much in those concavities with like the knee and the ankle and other joints that you mentioned. It's going to help bridge those gaps without having that bite to it. So this is a really good material if you have those very pronounced shape changes, like a crease or a smaller joint and then a large, calf. That's a very common one, like where the material comes in at the knee and then the calf blows out because it's a lower extremity lymphedema. I would really recommend the 550 over that type of shape versus something like the Mondi is going to have a lot more give to it. So that would not be for that type of shape of patient. So wall stability is very important there. And then as far as the top band goes, I know that was one of the things that you mentioned. So Medi top bands do not taper inward. And so the other thing that we do is when I do measurements, I don't typically add circumference at the top band, like you mentioned, but with these, the material that is underneath that top band is going to make a lot more of that difference. If they're going to swell into it or through that fabric, you'll notice a lot more of that shape change. So again, something with maybe a higher wall stability might benefit those type of patients that you're seeing that on.
Thank you, Jonathan. We have two more questions, and then we're gonna let you, be on your way.
Oh, no worries.
Okay, thank you. So, Fenton asks, what is the Forte fabric made from?
As far as like specific fiber structure, I would have to double check with the tag here. It is circular knit. Let me see if it is written on the tag what kind it is. It is. Yeah, it doesn't say specifically on here. I would have to check the box for the materials, or with Medi customer service. They might know those specifics of what exactly goes into it. But it's a circular knit material. It's just very strong circular knit compared to something that's more transparent.
I think it would be a good segue to discuss, like, what is the difference in circular knit and flat knit weaving? Like, can you describe it in a more detailed way?
Yeah, I will get into that just real quick. I know that all Medi garments are cotton free and latex free. So if that was part of his question, all Medi circular and flat knit garments are cotton-free and latex-free. So to answer back to Jeanette's question, how are they made? It's, let's see. So this is our forte. I don't know why it's blurring. Let's see if I can move it closer to me here. So this is spun, like I said, on a circular loom, and it all goes from toes to calf in one pass. And then the top end is added afterwards. And then of course it all gets dyed. So this is a single knit all the way start to finish, and then it gets sent off to production that way. The flat knit will always have this seam. 9 times out of 10, it's in the back here. So if you can see this, where's the video here? There it is. This seam along the posterior of the fabric. And so what happens, this material actually gets woven into a flat sheet based on the dimensions that are submitted by your fitter or your therapist. And then it's stitched together along the seam to give it a 3-dimensional shape. And so because it's not spun in a circular fashion, that's what gives it that reduced resting pressure, and it gives it more wall stability because it's more woven vertically than it is in a loop like this.
Thank you. So Ned just wanted to offer, because he's the one who asked about the 110 millimeters of mercury question. And he said that for 50 years, he's been wearing 2 garments that together total that amount of compression. And that's why he was wondering if there was a single garment that offered that.
Yeah, I think the only way you're going to be able to get that, Ned, is through stacking. If you need that much, and if you're wearing 2 circular knit, maybe we could try something like an inelastic garment with you, if you haven't tried that in the past, and see how that holds any different.
Thank you. And then Sean had asked that he was given a Circade, like a Circade reduction kit, and the therapist trimmed it as he was, achieving greater results. But then unfortunately he had a setback. And so now he doesn't fit into it. Are there any expansion straps that can be used temporarily until he can get his swelling back down?
Yes, there are. We actually have an extension kit, which is a separate piece of Circade material that can fit in between. So when you get a reduction kit, typically there's the long piece of fabric, which I refer to as the body of the kit. And then there's the spine of the kit, which has the additional Velcro that you size down, and that's what gets moved as you reduce. So with that extension kit, you don't have to buy a whole new kit. So it's going to save money for the patient, of course, but you can position that back in there halfway, and size it appropriately, of course, in between the spine and the body. And so they're kind of like Lego. You can just get a couple extra pieces and build to your, imagination's content, and really help to accommodate that additional size if necessary.
Thank you. The very last question is, what is the average lifespan of a circular knit garment and a flat knit garment? This is from Fenton.
Yeah, so all Medi knit garments, so not talking about the Circade per se, but the circular and flat knit garments, the material that's in there does have elasticity to it, and so it does wear down over time. Our garments have a 6-month compression guarantee. So if you purchased it in January, it'll hold that same dosage of compression up until through June. And if you have multiple pairs, like some insurances will cover like 2 or 3 pairs of garments, or even if you pay out of pocket, you have a couple sets. If you rotate them and you're not wearing the same piece every single day, that does prolong the lifespan of it because you're not putting that much wear and tear on each of those pieces. So you can get a little bit more out of it based on that rotational usage. The Circade pieces, there's the Essentials brand, Circade Essentials will have a 6-month compression guarantee, and then the premium Circade will have a 12-month guarantee. So it's actually a warranty for a whole year.
Jonathan, thank you so much for your time this evening.
My pleasure.
We appreciate your time and sharing your expertise. Thank you. And Charlotte, we're going to get to your question right now as I demonstrate everything. And thank you again, Jonathan, on behalf of Medi USA, for all of your amazing support and for the generous giveaway tonight, which we at the very end. And then we will probably connect them to you so we can make sure that happens.
Yeah. Absolutely.
Thank you so much, Jonathan.
Thank you.
All right. Good night.
Have a good evening.
Bye. Okay. So what I'd like to do now is I would like to just go over a couple of things as it relates to compression garments for the leg. The first is, what are the different options in terms of like the ending, like by the toes, right? So the first thing is you can have no toe, right? In which case, you have to really be mindful of like, is that appropriate for you? Is that enough? Oh, you can't see my screen. Thank you very much. Let me, well, can you see my video? My team, can you see my video okay?
Yes, we can.
Oh, okay, great. So this is basically an open toe, right? And again, like you want to make sure that first of all, it's absolutely appropriate, which means that you don't have toe swelling. Or another option would be that you get this because you have an effective toe cap. The toe cap is, again, where all of your toes are covered like a toe glove, right? And so the advantage of doing that and separating it is that it's easier to just focus on putting on the toe glove by itself and then worrying about the rest of the compression from the leg garment separately, because it's a little bit easier when you're putting on like a heavy duty compression garment and it's especially like a flat knit and you have an open toe. It'll make it a little bit easier. So those are some of the decisions that you have to think about when you're working with your therapist. Again, allow me to insert right here our disclaimer, which is that all of these webinars throughout the month are intended to just basically provide you with a deeper understanding of lymphedema therapy, lymphedema treatment, and self-management, so that it basically elevates you and it helps you to basically take your ability to take care of your lymphedema to the next level. And I'll give you an understanding in terms of what I mean by that. So for example, I read a lot and I've been doing a lot of study recently on sleep and the importance of it. And basically, I have understood and I've learned about the pathophysiology of what happens to your body if you get less than 7 hours of sleep. For every single human being, the minimum amount of sleep that is needed for you to actually have all of the good things happen during sleep for your body to restore itself, including like, the brain to basically rest and get rid of the proteins such as what contributes to Alzheimer's. You need to have 7 hours of sleep. So after thinking about that, like, oh my gosh, if I sleep less than 7 hours, I am actively, not letting my body totally restore itself. And so anyway, so for me, I'm usually a night owl, and I am now inspired to make sure that no matter what time I go to sleep, I get 7 full hours. So I'm hoping that as we deepen your understanding about all these things related to lymphedema therapy, that you're like, oh, I understand that now. And that is why I have to wear my garments every day. And that is why if I'm not like, happy with this garment, I should work with my therapist to make sure that, I make it right. And I find a way to make, or I find an option that will eventually make it a pleasurable experience to put on my compression garment. And so with today, I'm going to show you, a couple of different accessories that are available for you to put them on easily. I'm hoping that that's going to be like, oh my gosh, for so long, I've been, spending an extra, 15, 20, 30 minutes putting on my garments. And I realize now that I don't have to. And now I can actually, gain some of my time back. So anyway, going back to the toes. So this is an open toe, right? You can also have basically, your toes covered. Now, one thing to definitely keep in mind is that having the toes covered is not necessarily something that gives you compression in your toes. It is simply going to cover your toes and prevent the garment from riding up, because even though this open toe garment makes it a little bit easier to put on throughout the day, unless it's something like this where you have like some silicone borders on the bottom or some silicone beads on the bottom, and maybe you'll use the compression garment glue, and this is a flat knit, which makes it stiffer. What's going to want to happen is that the garment, again, is going to want to come into the narrow part of your foot, which is the middle of your foot. So that is the disadvantage of having an open toe. So the way to get rid of that is to basically have a closed toe, but there is no compression over each toe. Like if you have toe swelling, you'll still need to wear a toe cap, and you can wear a toe cap under this closed toe garment so that you have the effective compression that you need. But just realize having a closed toe does not give compression to the toes. And I imagine that some of you who might have tried it already would have quickly learned that. What you can do is also get something like this, which is basically an all-in-one. So this is like a mid-thigh garment, right? And it actually has, it's like a toe glove. It's like all in one. So this is a flat knit garment. This is from Medi. Thank you, Medi, for allowing me to have all these samples to show. Again, not necessarily an endorsement of the product, just, having it to have something to show you. And so as you can see, toes 1, 2, 3, and 4 are covered, but the pinky toe was left out. Now, again, if you had joined my toe bandaging session, I would say that, I feel as though the fifth toe is not one to be neglected, because, it can get swollen, and you'll see some pictures of patients that don't give any love to that fifth toe. And so everything is so well controlled, but then that fifth toe is like really engorged with a lot of swelling. You can get swelling there too. So it's important to take care of it one way or another. If for some reason, like you don't want to have it covered because of this garment being, it's very difficult sometimes to get it over that fifth toe, totally fine. But then make sure that at night that fifth toe is being bandaged, or you're adding something like kinesio tape, or you're spending extra time with manual lymphatic drainage over that fifth toe. So, but the toes are not to be neglected. Okay. So those are the ways of covering the toes. And then let's just go up the leg a little bit. Now, if you're going to end the garment like right at the knee, which is fine. In other words, it's a knee high, right? That's great. There are, like I said, this is like kind of like the normal contour of the lower leg. So here's our hourglass formation here, right at the ankle. And this was the question. Oh, forgive me. I forgot who asked the question. But it was like, how can you get the material out of the ankle? And again, it's a tough task to achieve, but it is possible. And the way that you would do that is, first of all, again, making sure that even if you have like a garment like this, you would actually add silicone to the end here. So especially if you're getting a custom made garment, you can actually add silicone here. You can make it 3/4, you can make it, all the way around. Another thing that can be done, let me see if I have a sample here. Yes, okay, great. So you can't, okay, there we go. So you can kind of see the seams there, right? So over here is basically, and over here are basically patches of silicone, so that it will grip your skin in these strategic areas. And you can even, there's not one here. This is just a different material to make it easy and comfortable in the back of the knee. But I'm gonna flip this inside out. And basically you can add silicone patches, in strategic places where especially it's at the top. You wouldn't need to add it at the most narrow part of your leg, right? Because that's where it's gonna want to go. You're gonna want to add it all the way at the top, somewhere in the middle of the thigh, or somewhere in the middle of the calf here, so that it doesn't slide down, right? And that's how you would do that. Or, as Jonathan mentioned, Medi has their own version of this. This is from Jobst, giving love to all the sponsors, and this is what I had here. But this is it stays also, and you basically put it on your skin just before you flip the garment onto your leg, and that will be another way to give traction, and it will prevent it from sliding down throughout the day. So that's that. Okay. So now, something very important to always keep in mind, all of these here are flat knit garments. And again, Jonathan described the difference. The weaving is basically a lot thicker, and the fabric is thicker, so that there is greater structural integrity, and it will maintain its shape much easier and much better with less effort compared to the circular knit, because the circular knit definitely wants to gather in at the most narrow points, even more so than flat knits. But what you can do is, just making sure that when you get an off-the-shelf garment, I can't stress this enough. I think that too often people get garments that are a little bit too long. And so again, like when you are like, especially on the cusp, or even if you're not, like even if you're a little bit over, I still err on the side of getting a shorter garment. So, I mean, this is just like a regular garment right here, right? But like I got a short version. First of all, my legs are super short, but even for your average person, if you get like a regular length garment, a regular length knee high, and it says that, your regular length, it doesn't always mean that you should get a regular length, because, if you, especially, this is especially true if you have a more narrow calf, right? Then the width is not being, the length is not being taken up by the width, right? The more narrow you are, the more it's going to want to just extend. And as you can see, this can extend quite a bit. This is a circular knit garment, right? And so always consider that if you have a hard time distributing the material evenly and getting it out of your joints, so this answers the question that was asked before about the ankle. Most likely what could, one easy fix is to get a shorter garment. So you'll see that basically, even with this, like if I were to put this on, I mean, this is a short garment and it's still too long for me, but still, can you imagine if I got the regular length? But basically, when you get a shorter length garment, you can pull it and it will go up to where it should be, and you won't have to worry about being as particular with distributing the pressures, not the pressures, the fabric, and along with that, the pressures as much, because then it'll just, the length would just be taken up and it should just sit where it would like to. So the take-home message of that whole thing right there was, when you're not sure, err on the side of a shorter garment for a ready-to-wear garment. And you'll see, you can even like, when you're going into like a fitting store, or when you have the option to get a couple of garments and return one, like, right away, get one that, is regular, get one that is shorter, and try them both. And you'll usually see that the shorter one is the one that will be better because it's less of a hassle. Okay. So that's the same thing. And that's the same thing for the thigh high as well. Whether it's a knee high, thigh high, arm sleeve, you want to have less fabric to have to maneuver and fix whenever possible, right? But still have adequate coverage. Okay, so that's coverage, the silicones. Okay, so now perhaps I can just go into showing you how to put on these garments with a couple of accessories that will make it easier for you. So let me just fix my camera. I'll start with the knee highs. Okay, so the first thing is this is the Arion from Jobst, and basically this is going to be something that is for a closed toe, right? Or it could be for the arm sleeve, but for our purposes today, it's for the open toe. Forgive me, I misspoke. It could be for the arm sleeve, but for our purposes today, it is for the open toe. So now I have an open toe thigh high, actually. I don't have an open toe knee high. So I'm just gonna get this on to the point where I will have it right on my leg, but might as well go all the way to the top. So I'll show you what to do. So basically, the silicone is meant to, grip you, right? So you have to turn that part inside out. That's the first thing. And now the next thing is, this is an important part too. And for those of you who joined us for the upper extremity, this is the same point. What so many people do, and I definitely do not recommend that you do, is to do this. But so many people do this, right? But whose leg is that small? Nobody's, right? Basically, whenever you gather all this material, you also exponentially intensify the compression. And there is no leg that is that small. Like, it won't even fit my arm, right? And so what happens when you do this is that it makes it impossible for one thing. You hurt your hands for another. And then what happens is that you will inevitably have the garment bundled up over your leg, and it's going to hurt because it's going to be like a little bit of a tourniquet effect. So this is how a lot of people do this, right? So you put this on and you're like, you can't really get it all the way. And then you have all the garment gathered here. And then what happens, it digs into your ankle, right? And then basically it's going to cause a tourniquet, and then you're taking a break. And then when you're ready to resume, it's going to now have a deep indentation. And now you're going to have to worry about the garment wanting to gather into that deep indentation. But on top of that, it's going to be very uncomfortable and possibly even painful. So you do not do that. That is what you do not do. Okay. But what you do again is you flip the silicone border inside out. You leave the whole garment, whether it's a thigh high like this, or whether it's a knee high. If you have the silicone border, it still flips out, but you leave it extended, right? Then you're going to lay it down and make sure that the heel is in the right orientation, because obviously it's going to be such an inconvenience if you got this whole thing up and then you realize that the whole thing is twisted. So you want to make sure that the heel is in the same direction as your heel. So I'm going to get that first, and then I'm going to lay it down, right? And then I'm going to put on this garment donner. And so basically what this does, it takes away all the friction from your foot, from your toes, and from your lower leg even. Okay. Then depending on the degree of flexibility that you have, right, if possible, you want to just try to make it as easy as possible for you. So I think I'm relatively flexible, so I can just reach over, my legs are straight, and then just do it this way. But let's just say you're not as flexible. Then you would be sitting on a chair. You would have your foot up on an ottoman so that you can then reach over and put it on, right? And that, if that's not an option, then what you can also do is, still keeping in mind the direction of your heel, you may have to, if you're sitting down, do a figure 4. And then obviously the direction of the heel has changed. So I'm going to make sure that my heel is in the same direction as well. So it's kind of lying sideways. And then you get the beginning of the garment on that way, right? Okay. No matter which way you get started, you want to make sure that you keep the direction of the heel. So I want to check this one more time. Okay. And then you're going to just pull until you find a resistance. At some point you'll reach your thigh, and then it's going to give a little bit of resistance. So you're going to pull until you have no more resistance, or excuse me, until you have resistance, shall I say. And to make sure that this doesn't just quickly slide back down, I will now pull the silicone border right side in so that it won't glide down. Then you put on gloves. Now I have Job's gloves here, but every manufacturer has them, and Medi has them as well. So I'm so sorry, Jonathan and Medi, I don't have a sample to use for the demo today. But these gloves are crucial to basically making your life easier in terms of putting on garments. So basically they come with the palms having these textured, material where it makes it easy for you to grip. Now, if you are not able to reach down, you can just keep pulling it up from here, like so. And keeping in mind that this is going to, when this gets pulled out, you are actually going to be pulling some of the garment down. So I almost never leave the end of the garment exactly where it should be. I'm actually going to pull it up even more, knowing that when I pull that out, it's gonna actually come down a little bit. But now that that's there, you smooth it out over the rest of your leg, making sure that at the top, it's where it should be. And this should basically be all the way up to your groin. So I'm just gonna make this easier for me because at the top here, I don't need the gloves. It's only when I'm basically smoothing out the rest of it. Well, I need it. But you can see here, it's gathering at my knee. I'd like to avoid that as soon as possible. So now I'm going to smooth it out at the top. Okay, and now smooth this up on the bottom here by my calf. And now I have to get this easy slider off. Now, you can either have a caregiver, a family member, pull it for you, which is always kind of fun. If I was by myself, you can also use like a doorknob or like a hook. Sometimes there's like these things at the bottom that prevent the door from like totally crashing into the wall. They kind of serve as a hook also. Otherwise, you can just basically step on it like so. And it comes out that way. And that didn't exactly go as planned, but that's okay. I'm gonna like fix it nonetheless. Okay, so now this is an important thing to take a look and see, right? Because right now it looks like it's relatively on well, right? Like it's kind of smooth. I think that if you really take a close look, it's a little bit bunchy by the knee here. So what needs to happen, just clear the frame for you a little bit. Okay. Okay. So what needs to happen now, before you go about your day, you actually have to take the time to smooth everything out. And this is, very important for you to set yourself up for the day. And again, this goes back to the question about like, how can you prevent things from, occurring at the ankle? So again, you could have added the It Stays glue over here around the calf, because then it won't want to gather down and into the knee. And then you want to take a look and see, like, even if you move your leg, right? Like you'll see like where it's like really tight, and I feel it behind my knee. So I'm going to make sure that I pull on this and bring it up. And make sure that everything is nice and even. Now, for me, for the silicone border, everybody has a little bit of a difference in opinion, but I like it where it kind of sits on an angle following my inguinal crease. So I like it where it kind of breaks the pattern a little bit of allowing the silicone border to going straight across, which can allow for it to cinch in. And this was Leora's question, right? She was like, when are you gonna come out with a garment that ends on a slant to cover the lateral hip as well? And I always thought that myself. Like I don't really like it where, when you have the silicone border, and especially if it's the one that like really grips in. So the way that I break that is I just make sure that the outer part is up a little bit more, so that I do grab some more of that hip. And then on the back here, it goes along your gluteal fold, right? The crease of your butt. And then I think that that's a little bit more comfortable. But that's the first part. The next part is to make sure that there is as much fabric throughout, from your toes to your thigh. Now, in the camera, I think I can see, and you can tell me if I'm wrong, but it looks a little dark down here by the foot. You can see through to my skin more here, and see through to my skin here. You can kind of see it's a little bit dark back here. So that will tell you that it's not totally even yet. So what I like to do then is to make sure that basically over here by my foot, I actually pull it down towards my toes a little bit to make sure that it's a little bit more spread out there. The heel should be where the heel is. Now, when you flex your joints, you should not see like all these wrinkles there. There should only be like one crease at like a decent angle once you flex your foot and flex your knee. So I'm gonna pull this a little bit more towards the toes. And I'm also going to grab the material above the ankle and bring it to the center of my calf, so that there is not so much material by the ankle. I want it over the most wide part of my leg, which is my calf. Now you'll see, oh, that's still happening. Let me just try this one more time. See, I am actually going to take a moment to use the glue right here because it just wants to gather right over my foot or right over my ankle. There we go. Now you can kind of see it's kind of glistening a little bit, maybe not. It's a little bit too bright for you, but it's on. And now I'm going to put my foot piece on where I would like for it to be. I don't mind that that's like over my toes because there's no compression over that last little bit there. But now when I bend my foot, you can see there aren't a million wrinkles there, right? You don't really see any. And that's what you want. Then I know there is not too much material there, right? But now let's check my ankle. I'm sorry. I do know my anatomy. Let's check my knee. You can kind of see it, there's a bit of a deep crease there. So my ankle is good. My calf is pretty good, but now I want to fix like my knee. So what I will do is again, pull it up into the middle of my thigh to the widest part of my thigh, but also pull a little bit from right below the knee into the widest part of my calf. I pulled it up into the middle of my calf, and now I want to pull it down and have the most compression or the most fabric there, just because you'll see that over the day, the course of the day, it'll slide down naturally. But now this is a lot more comfortable. And now, like when I bend my knee, I don't feel it like digging into my ankle or my knee. Like both joints are pretty comfortable. So my point with this whole demonstration is that it takes a couple of minutes to make sure that the garment is on right. The first thing is to make sure that you bring it up to the length that you want it to be, making sure that it ends where you want it to be down here by the toes. You want to distribute the material evenly over the entire leg, minimizing the material over the joints of the leg, and bringing it up into the most wide parts of the leg. And then again, as you start to move throughout the day, it might shift a little bit, but you've already set it up where you're going to be pretty comfortable. Whenever you want things to stay in place a little bit more, you would have had a silicone border, or you would have used like the compression garment glue. Okay, taking it off, whether it's a knee high or whether it's a thigh high, taking it off, the best way is to peel it like a banana. And that way it will help to preserve the structure of the garment as opposed to fatiguing the material a little bit, and also saving you a lot of like torture. Because what happens, most people, if they aren't instructed on what to do, they basically inch it down like so, right? And eventually it develops this like harsh, tourniquet that I had shown you when you gathered up the material. Well, that's going to happen on your leg, and you don't want that. So the best way to do this is to just simply peel it like a banana, inside out, like so, right? And then you have your gloves. And you just keep going inside out like this, making sure the whole thing is flat all the way through. At some point, when you have the silicone border, like at the area of your toes, you can actually have your other foot hook onto it a little bit and help you out. But you keep having even pressure with your entire palms, and you keep sliding it off like a banana peel, right? Now, at some point, what I also do is I just tell patients to just step on it like so. And it comes off that way too. And so at the end, the whole thing is turned inside out. Now, that's totally fine because you didn't really fatigue the garment, and you can easily turn it right side out again. Okay, so that's that. That's like that's using a garment device. I'm sorry, a garment donning device such as this. Now the question could be, what do you do if you have a closed toe garment? And just to keep in the same family of this donning device, there is this magnide, right? And so this thing here is meant to basically help you get your garments on if you have a closed toe. So it opens up completely, and it's held together with magnets, hence the name magnide. And so all of these 5 magnets line up, but then also you want to get rid of the friction from your toes. So this magnet goes on top of this magnet here. And you can use something like this. This is a piece of Dyson, readily available, online. It's what construction workers use to basically make sure that when they put the ladder on, they don't slip, or if they're in an area where they're worried about slippage, that, it'll help to prevent that. So you can use this for your device as well. Juzo has something called a slippy gator. It's a green pad. I don't have it for the demonstration today, but it works the same way. The great thing about this piece of Dyson is that once you start to collect a lot of lint on it, because it does have a little bit of this like stickiness to it, all you have to do is wash it with soapy water and it renews the adhesiveness. So it's kind of cool. Okay, so I'm gonna put this down here. I'm going to get my closed toe garment here, making sure that my heel is where it should be, getting it all set, putting this on. Okay, I'm gonna put on my gloves. Okay, and then again, depending on your flexibility, you're just going to, I have this here just in case you were to need it and to demonstrate how to use it. But again, if you have the ability to just reach forward, you just do so. And you just keep pulling until it's where it should be. Oh, I forgot to make sure that I have the end ready. Oh, it's right here. There we go. You need that in order to like pull this whole thing out. And then you want to fix it so that it's pretty much where you'd like for it to be, because this is the time. So like, let's just say I were to have had my heel all twisted and it's towards the front. This is the time to actually fix it while the magnet is still on. And then fix everything into place. And then you can take this off now. And then basically this just pulls off. And so now your closed toe garment is on, right? So I'm gonna do that again. Oh, and of course, like I said before, but I'm just not gonna highlight it too much here because I already did it. You wanna make sure that everything is in place, right? And you wanna make sure that when you bend your knee, it is not in the knee crease. It should be like 1 centimeter below the knee crease. Not too low, because it's gonna just slide from there, but 1 centimeter below the knee crease. But it should not be gathering in the knee, right? So this garment is my garment. I do wear compression garments. And so this is for me. And so to quickly just demonstrate how it should fit, I pull on this toe and make sure the heel is where it is. And as you can see, the color is pretty even all around. You can see through to my skin evenly all the way around, right? Okay, but I'm going to show you again. Let's just say you have a larger belly. Let's say you don't have the flexibility, or let's say you don't necessarily have the strength. I'm going to do this again. Pretty easy to set this up. Oops, did it the wrong way. Sorry. You should see the magnets in the front. Okay, and then this is here. This goes in the back. Just like so. Okay, let me get the garment over here. Okay, so now if you didn't have the flexibility, let me just make this frame clear for you. You would, of course, you would have to find a way to at least get it started, right? Whether it's like bending your knee, your foot is on the ottoman, like so, or whether you had your knee, your ankle up on your other knee in a figure 4, whatever it is, you find a way to get it started, or even your family member helping you a little bit just to get started, right? You get it to the point where it's on your foot, for the most part. And then from there, you basically allow your foot to be completely flat on the Dyson, or if it was the Juzo Slippy Gator, your foot is flat on the Slippy Gator. With your foot flat on that sticky pad, you just keep pushing forward. Right? Until it's on your toes for the most part. It is not necessarily easy. but you'll still need at some point to be able to have this. And as you continue to do this, you pull up. Until your toes are where it should be. Is it there yet? It's there, it's just a little crooked. Okay, so it's there, and from here, you pull it out. And of course, you still need to fix it. All right, so that's that. Fix it, make sure it fits right. Okay, so that's the Magnite and the Arion. Now, another thing that's available is the Butler. Now, this is the arm Butler actually, which means it's just smaller. It's shorter and smaller, but because I have short legs, it will work for me just fine. And get that Dyson out of the way. So when you're working with this, what you will do is you will set the garment up. This thing right here, if you take a look, if I do it this way for you, this part is where your foot will kind of go through. So you won't have to worry about like the Butler basically crushing your legs in any way, shape, or form. But you are going to basically, you know, it has these handlebars where you won't have to reach all the way down to your feet. You can actually have, you know, just enough flexibility to get to like your mid calf or even your knee, because this would be longer for the leg. Again, this is like for the arm, so it's much shorter. But you're going to set it up. I'll put it this way for you. So you're going to set it up where the heel will be facing you. You then basically keep bringing the top portion of the garment inside out until you see the heel, where you can see it right there. So there isn't much that's left. It's just the foot, right? And then you hold this in place. You put your foot through. And then you just slide it up. And it's like pretty much in place. But I didn't set it properly, so I'm going to do this again and show you what it should look like. So let me set this up one more time, making sure the heel is where it is. This is inside out, but that's okay. It's the same thing. You get the idea. So I'm going to bring it pretty much all the way down. I brought it so that it's at the end. And so as soon as my foot goes in, my toes will be right where it should be. That's a lot better. And then of course you'll have to like fix it a little bit here and there to make sure that it's where it should be, right? Okay, so that's the Butler. Taking it off, same thing, you peel it like a banana. Okay, and then we also have, this is called Easy As, and it works a lot like the Butler. It's a device that will basically set the garment for you. And so, start here. Yes, that's right. Oh, forgive me, one thing. Forgive me, this would be pulling it up this way. Forgive me, 1 second. I know this basically. Yes, okay, got it. This is going to be set where you're going to be pulling it up like this. So similar to the Butler, where you're pulling it like this, right? This is how it's going to be pulled up. So, but when you set it, so you're going to set it as if you're going to put it on. So it's this way. Let me just put on my gloves. So it totally opens up the garment for you. I brought it all the way to the end. So now you get your foot, this hole, let me show you the other one. This hole is so that your heel can fit through it and it can be comfortable. So now I'm going to put my foot through. You see my heel sticking out right there. And then I just pull it up and then it slides out, right? And then you put it on and you like fix it in place. Now, the thing with this one is like, it's meant to like set it up so that you can navigate the foot and the heel, which is often the most difficult portions of donning a foot garment, or I'm sorry, a leg garment, right? It also comes with these clips that basically act as extensions so that basically you can pull this up as well. So it's kind of like the butler, except it's a little bit more loose. So it just doesn't, you can kind of adjust the length of this a little bit, and you can just let it hang, and then you can just pull this up. So that's just another option. This is from a company called Easy As. Okay, taking this off, same thing. And again, I don't have the gaiter, the slippy gaiter to demonstrate, but that is another one from one of our other sponsors. So I hope that was helpful. Do we have any questions, Alyssa?
Yes, we have a few questions, Jeanette.
Okay.
Do you have a flat knit toe cap to show by any chance?
A flat knit toe cap. If you give me 1 second, I may.
Okay.
I have a whole bunch of samples over here, and let me see.
If she doesn't, I do.
Oh, Jonathan,
Great.
please do show.
Hi, everybody again. So this is a custom toe cap. This is actually for my,
Wait, one second, Jonathan, because I have to spotlight you.
oh, I'm sorry.
Yeah. Now it's all you. You go ahead.
All right. So this is one of our custom flat knit toe caps. This is actually for my giant Fred Flintstone foot. And this is out of our new Cozy 450 material, which is unique that it has the 550 fabric on the bottom to be more durable. But then the top is that Cozy 450 material. And you can see there's you can see if it's not blurry, maybe there's this design elements print in there with the pyramids. And this does have the pinky toe. So, you know, all toes matter. I saw somebody type that in the chat as well. So this is open toed. You can do closed toed. It's just very uncommon because of nail growth, especially for patients with lymphedema, having issues with their toenails. And this is a standalone toe cap. So you can put this on over a knee high at the ending, or first, whichever is your preference. They're meant to work together. Or as Jeanette showed that sample of the Lilac 550 thigh high with attached toe cap, it can be seamlessly stitched together. So it's all one piece. Some patients like to have the option of taking the toe cap off separate and wearing different footwear or things like that. Some patients like when it's all one piece together so they don't have to manage multiple pieces all at the same time. So.
And I did find one.
There it is. That's the one without the pinky toe, though.
Yeah, Louisa is our New York City like rep, and she left me a whole bag for this one. So I was like, oh my gosh, she's got to have one. And so this is like an example. So you can see it's quite like thick, right? It's very different from let's say like one of the toe caps that are ready to wear. It's a lot thinner. You can kind of see there. This is a lot thicker. So yeah, again, this is also like without the pinky toe, which, you know, not my favorite because I'm very protective of the fifth toe. All right.
And I did see one question in the chat about bunions. So this is another sample that I have here of our 550 closed-toed garment. And we do have an option for a relief zone over bunions. And so here we have the hallux ease and varus ease on the other side. So hallux being for the big toe and the varus ease being for the pinky toe. So if you have a bunion or bunionette. So if you do a closed-toed flat knit garment in our Cozy 450 or Medi 550 fabrics, we can choose these options to create a pressure relief over that bony prominence so that it is more comfortable. Our Mondi 350 fabric has a little bit more elasticity to it, so it tends to be more comfortable over those bony prominences. And if it's an open toe garment, there's typically not that much pressure over the toe box that it's going to compress there. So it's not an option in the open toe, but for closed toed, you can add that in from Medi.
Thanks so much, Jonathan.
Yeah, you're welcome.
All right, Alyssa, do you have more questions?
Okay. Yes. So about the glue. So if you're using It Stays, do you if you need to put the glue behind the knee, do you pull the garment down and apply? And how long does the glue last?
Oh, it lasts the whole day. It lasts until you wash it off. Jonathan, is that correct?
Yes, it's a water soluble glue, so it comes off easily in the shower, just with your normal body wash or soap. But it does hold in the garment. Typically, you would use it on the end points of the garment because that's what's going to help hold it in place the best. So not usually right behind the knee. I would do like Jeanette did, kind of at the foot or at the top of the thigh at the silicone band. That's where I would recommend to use it.
Yeah.
And I saw somebody ask about silicone patches in there too, because that's kind of like a similar thing. So as far as off the shelf options are or go, we can do custom alterations to an off the shelf garment. It is an upcharge. So you would purchase the off the shelf garment sizing, color, whatever you'd like, and then send it to corporate or to the customs alterations team in North Carolina. They can put on some additional, like if it's open toe and you want it closed toe, they could do that. Or if you wanted to do some other changes to it, we do have some options there. In the flat knit, I know Jeanette showed that sample with the additional silicone patches in there, and those are great for addressing some of those slippage issues. So if you have an abnormal shape in the thigh or a lobe or something like that, and you're concerned about that, those additional silicone patches that she mentioned or that she showed also work kind of in place of putting glue behind the knee. It would have a silicone grip behind the knee instead, or on top of the thigh or along the oblique, etc.
Yeah, thank you so much. So just to basically demonstrate, right, like where you would want to add the silicone, I'm sorry, not the silicone, well, actually the silicone, and also that it stays, it would be like over the widest part of the thigh, or, and the widest part of the knee. Or what I sometimes do is I add like lines all throughout, right? Lines all throughout so that the whole thing just stays put. Yeah. Okay, Alyssa, next question, please.
Okay, will the magnet donor work with very high compression, such as a 50 millimeter mercury flat knit?
Yeah, it does. It does. The only thing to just be mindful of is like with the Magnide, this part here is meant to go over the toes, and with higher compressions though, you might want to consider maybe having this open because then it'll be easier to slide out, because with higher compression, this might grip it so tightly in the foot that it's going to like be a little bit of a challenge to come over the toe and unlock that way. So something to consider is maybe just like not necessarily having the magnet on top over here to cover the toes, but to just like let it be loose. But again, everything is really trial and error, and you just have to find out what is like what the best thing for you. Try it with the orange part over the foot. Try it with it out. Without it, try a different accessory. There are lots of things to try. And I would say these are relatively inexpensive, that it's worth giving it a try to make your life easier on a day-to-day basis.
Sounds good. So Sean says, my calves are very large and I have tried to use the extra large butler, but it can be painful since the metal frame does not stretch. Can you recommend a donning tool for larger legs?
Well, Jonathan, do you have anything to say to suggest to Sean first?
Yeah, we do have a large butler. So the butler that Jeanette showed was our Assure butler, which is our kind of our economy version. We also have the traditional Medi butler, which has a little bit longer handles. Then we have the big butler for those extra wide calves. And those should all be available through same, local or online or wherever DME product suppliers. And then we even have a pantyhose butler. You can do two legs at the same time.
Yes, I was going to say that.
Yes, and then I know Jeanette showed it was a leg butler. Our arm butler actually is really nice. It has a hook that will set onto a countertop or a table or something to that effect, so that you can slide your arm in through it much more easily. So we do have the butler for the arm as well as for legs.
Yep. Thank you.
Sean says that they still have.
Wait 1 second. So Easy As, at the company that I just told you about, they have like these different sizes. So this is their like extra large. This is something that could accommodate a larger calf. As you can see, I'll show you here. 1 second. So it's quite large. My calves are pretty large. So, you know, and again, this is like only meant for the foot. So as it comes up, it'll just like hug the large calf gently and accommodate it.
And the big thing with the butlers too, the big part of, or the challenge of getting on those circular knit garments is turning the corner at the heel. So once you can get it at least past the heel, even if it doesn't accommodate the full size of your calf, Sean, it's getting it past that ankle and then allowing you to at least reach and pull the rest of it up the rest of the way.
Thank you.
Mhm.
Next question.
Okay. Can the It Stays glue be worn with a circade on the thigh piece?
That's a great question. You know, I have not personally used it in that way. I'm not positive, if I'm being honest, on how it would react with the material because it is a different, construction of fabric versus the top band or the knit fabric. I can look into it and get back to you and give Jeanette an answer, and she can relay that information to you if that's okay.
Sounds good. I mean, you know, we'll wait for your answer to be the definitive answer, but let's give it a try. I'd go for it.
Yeah, I mean,
you know, it's like, it's water soluble. I can't imagine that if it doesn't harm like these more delicate fabrics, that it would harm a more durable fabric like, you know, circade. So that's my intuition, but we'll see what you say.
Yeah, I'll find out.
Yeah, thank you. Alyssa, next question.
And Fenton is just asking about a website to see the butler and the garment products. So we will we be posting that in the chat for him and for everybody else?
Jonathan will take a look and see if, and can you, Fenton, do you want, you know what, we'll just do an example of all the leg butlers. I'm going to ask for Mehdi to make, especially for the National Lymphedema Network, a video that demonstrates the use of all butlers for the lower extremity, and we'll post it on our website.
Okay, you can do that.
Sounds good, right? All right.
Yeah.
And then, anything else, Lissa?
Nope, that was it. Let me see. Yes, that was it.
Excellent. Well, thank you so much to everybody who stayed to the very end. We would like to thank you by doing our drawing now. And so Jennifer has our wheel. And you know what makes it a little bit more exciting, Jennifer, is when you share your computer sound. So when you share your screen, before you actually click the application of the wheel, you can actually, there's a little checkbox at the bottom that says share computer sound. Do that to make it a little bit more exciting. Okay. All right, so I'm gonna turn off your video. Actually, no, let me spotlight you 1 second. I'm gonna add you. Okay, there we go.
All right, here we go.
All right. Ooh,
Charlene.
just made it, Charlene. All right. Congratulations, Charlene. And Charlene, what we're going to do is, Jonathan, should she just connect with you right now? Can you put into the chat for Charlene your email address so that we can get her the circade that she needs?
Yeah, I can do that right now. Yep. Let me just type it
Charlene, the one thing that I forgot to say, but it's okay since we didn't say it already. It's best that if you're a patient, that we can work with your therapist to make sure that we get you the right sizing and everything. And if you're a therapist giving it away to a patient, even easier. But since we forgot to say that, we're gonna make sure that you get a circade one way or another. And so Jonathan is putting his email in right now. And with that, we are so over time. Like, again, I've been saying almost every webinar that there is so much to talk about with lymphedema. So many nuances, so many specialties, so many topics of focus. And yesterday, I was totally disoriented because I've been doing this like every day for the past 21 days. I lost track of time and I thought yesterday was Sunday, but I was so excited that yesterday was Saturday and that today is Sunday. So anyway, you have so many choices in terms of how you would spend your Sunday night, your actual Sunday night, and you chose to send it, you chose to spend it with us. And so we're so grateful for your time and attention. And we hope that you learned a lot today. We hope that you got a lot out of it. And we hope that that it's going to take your self-care activities to the next level if you're a patient. And for those clinicians, we hope that you learned a little something too. Jonathan, thank you so much for being on with us.
My pleasure.
And good night, everyone. Good night from New York. Good night from Arizona, right?
Yeah, Phoenix. It's
Yeah.
still daylight here.
Yeah, indeed.
It's like 80
definitely-
degrees and sunny. It's beautiful.
Nice, nice, nice. It's actually beautiful here too. It's like 57 degrees here in New York. Wherever you might be, we hope you're enjoying some beautiful weather. Have a great evening no matter what. Okay, bye-bye.